Welcome to the Misfit One Lifestyles with Elizabeth Colin. She will awaken and connect with your Misfit One. Are you tired of the ups and downs in your life? Are you ready to live a healthy lifestyle once and for all? We are talking about all aspects of your life. Being fit is not just physical, it's also your mind and soul. Learn how to take steps in your life to move towards your goals. Elizabeth's goal is for everyone listening to the sound of her voice to get fit. Let's get focused, let's get intentional, and let's transform. Now here's your host, Elizabeth Colin.
Hey guys, welcome to another edition of Misfit One Lifestyles, and I'm your host, Elizabeth Colin, and today's guest is amazing. You know, there's this saying that says, a good physician treats the disease. The great physician treats the patient who has the disease. My guest today is an exceptional physician because she treats the patient and the disease from the safety of their own home. Now, girl, now that is something else. Dr. Dorsha James, how are you doing?
I'm well. How are you doing today?
I am wonderful. You are so phenomenal.
Oh,
I'm like,
that.
You are really, I was looking over the things and I was like, wow. You know, that saying resonates with me because, you know, you always want a doctor, of course, to always take care of you. Right? Not just what's your symptoms, da-da-da-da. But to have you, Dr. Dorsey, go a step above and treat me from my home.
Right.
Can you tell us about your company?
Yeah, I can. Briefly, just a little bit of background. I trained in emergency medicine, and I actually trained at a school that that focused a lot on treating patients. That was what they instilled in us. That's what we, you know, every time we saw a patient, that's what our attendings were checking to see. And so as I got out of medical school, I did my residency at Vanderbilt, and my wife always tells me to toot my own horn. I was the first African-American female to do the Department of Emergency Medicine, which is crazy because that was 2005. But I get to Vanderbilt, and, you know, in the emergency department, you have people who are at their worst. They're at their complete worst. And so usually they're there by themselves or they're there with family members who are freaking out. And so you really have to have that, you know, bedside manner for people to actually trust you. I tell people that within the first 30 seconds of someone meeting me, they have to trust me with their bodies, with their minds, with their health care. Yeah, with their life. And so, you know, I had to develop skills that actually that helped me, you know, even just in day-to-day life, but to help me with my patients and to give them great service. So the company is called MyUrgencyMD. We actually have a nationwide network of doctors, and all of these doctors have been trained in phone side manner. They went through training. They went through training. They went through training to actually know how to treat patients at home. Now, the good part about it is, I mean, you're meeting this person over the phone. You have to trust them as well. You have to trust your physician within the first 30 seconds. Most of these are urgencies that they're calling for. But these physicians have to be able to, if it's an emergency or if the person is freaking out, they still have to be able to talk to that person and calm them down and just kind of, you know, reassure them that what the care that they're getting is appropriate, and is necessary. And then if all else fails, they can send them to the ER.
You know, and it's so crazy when you say phone side manner, because I was looking at these things, and I guess, you know, now with COVID, we all are trying not to go to the doctor for anything. And we saw that people were dying more at home now because they're so afraid to go in for whatever we're supposed to go, like if we having chest pains or whatever. Now everybody's too scared. Like I keep thinking I'm having COVID all the time. I sneeze, I'm like, oh my God, I got COVID. Like, so when you say you have 50, because it's everywhere, 50 states, right?
Plus Puerto Rico.
And Puerto Rico, yeah.
Mm-hmm.
And I never thought about it for an emergency. So when you said that, have a phone side, like a bedside voice, how does that look? Can you kind of walk us through? Because I am aware of, because I've been going to my doctor appointments online. So, but that's a routine things. What kind of emergency could you call in for?
So I tell people all the time, the reason why we titled it MyUrgencyMD is because we don't want people to think that it's an alternative to 911. What I can say, however, is that we have all board certified doctors. So, no nurse practitioners, no physician assistants, which I think is perfectly fine. But our network of physicians are MDs and DOs. And so what I tell people all the time about our company is that when you call in, you can actually talk to a doctor. So a physician who will tell you, you know what, you're 65 years old, you're having chest pain, you're having a fever and some cough. I think you need to go to the emergency department, as opposed to them doing nothing, or even worse, Googling their symptoms, thinking that they're, okay, and just take some. Is that you?
That's me. Okay, so it was so funny. That's so me. I'm like, I try to say I'm not going to Google anything, first of all. But my kids are grown, so they think that they're my mom and dad. So I literally wasn't feeling well, and they were like, just go to the doctor. You probably have corona. And I'm like, no, I don't think so. Mom, go. And so then they start researching stuff. They don't put me on my deathbed, doctor.
Right.
And then they have to say, well, let's not panic. I'm like, I wasn't panicking.
Until you Google.
So I love the fact that you can talk to someone, because that's probably what I should have done instead of listening to them bad cheering of mine.
Right.
Keep scaring me to death.
And I call it Dr. Google. It's Dr. Google. And then you also have WebMD, and those two things.
Yes.
When I work in the emergency department, so I've actually retired to run this company full time. And so, but when I worked in the emergency department, it was the bane of my existence for people to come in and be like, okay, these are the 10 things that I know I have. I need you to tell me which one of them. I'm like, oh my God, you sprained your ankle. Like, are you serious?
Sit down. Have several seats, please.
Sit down somewhere. Like, come on. Well, no, I heard about bone cancer. And then, I'm just like, no.
I think I have 2 months to live. What? Like, what are you doing?
It gives you that sense of assurance that you're talking to someone. But even better, when you go in to schedule a consult on our service, if you type in, or if you choose, you don't have to type it in, but if you choose the options, chest pain, abdominal pain, things like that, headache, weakness, then it pops up red that says this is a symptom that most likely cannot be taken care of via telemedicine.
Got you.
If you still choose to see a doctor, well, that's better than just ignoring it or not going anywhere.
Right.
So the doctor can tell you, like I said, you're having these type of symptoms, you should probably go to the ER, or this is something that you can follow up with your doctor about in a couple days, or you don't need to see anybody for anything. So I like to tell people it's a triage process.
I love that. And can you kind of walk us through that? First of all, give us your website that I was reading it earlier, and so I wanted to kind of go through it, because I think it's like MyUrgencyMD.com.
Yep, that's it. MyUrgencyMD.com. And so what you would do, and I just want to say another service that we have is the behavioral health.
Yes, I'm going to get to that. Mm-hmm.
Yeah. So when you get to our website, you go in, you go to join now, you'll put in all of your information, you get an activation email immediately. And then right that moment, you can see a doctor. You can schedule the doctor to be seen. So like, for instance, if you want to see them tomorrow on your lunch break, or you can see them immediately. Our callback time averages about 19 to 23 minutes. So
get out of here.
And most of the time it's faster than that. 5 to 7 minutes. I mean, I have family members who have the service, and they're like, oh my God, I literally got a call back in 5 minutes.
That is awesome.
It is. And so just imagine getting in your car, going wherever the urgent care is, paying a copay up front.
And sitting there all day.
Sitting in the room or sitting in the waiting room with other people, getting back to the room. I mean, it's just a hassle. And there's so many things. The statistics say that 70% of primary care office visits can be handled over video, phone, or email. 70%.
Listen, I'm so happy that you said that, because my husband, like I said, during the COVID, everything was shut down. So everybody switched over. I'm so blessed that my doctor and I have a great relationship. So she knows me. She can even tell when she look at me like, yeah, what's going on? I'm like, oh my God. So she kind of knows. But my husband his doctor won't do virtual. And he's older. My husband's almost 60. And he has to go get his refill. He's going to kill me. I said he almost 60. Listen.
We didn't hear it. I think your computer broke up.
He don't listen to my show anyway. I can tell him. I can say whatever I want. He don't listen. But he has to take medication for high blood pressure, all those things. I have none of that. So I don't feel, I'm not scared. You know what I mean? That I can talk to my doctor over the phone. But he has a lot of underlining things. Not a lot, but he has underlining things. So his doctor won't even refill his prescription until he comes in. And it's like, that's craziness. Out of all the other doctors at the place, his doctor is the only one who does not. Is it a male doctor?
Mm-hmm. Is it an older male doctor?
Old white man.
Okay, so
let's just go on and say it.
Okay, so they don't like change whatsoever, and this is the thing, and I'll just say this for any old school doctor, black, white, male, female, mostly the males though, they're used to people doing everything for them. And so that means that if they have to sit down, log into the computer, type in their notes, that's a hassle. A hassle that they just no.
I ain't doing that.
Yeah, I have underlying conditions too. And my doctor, saw me over the computer, gave me a refill. I mean, there are some people who are they just don't believe in it. They don't believe in telemedicine at all. And so this company, it's been around since 2018. And I tell people all the time that it was very hard for me to talk to a person and have to explain to them what telemedicine was and then ask them to support my company. So you can't really do that in the same setting. Right. You can't explain to someone what something is and then say, hey, well, how about you purchase it?
Yeah. Call me. They like,
I don't know about that. So COVID came and I've been so passionate about telemedicine, for 5 years. It's just because I saw the vision 5 years ago. I saw it. I'm like, oh my God, this is going to change the ER. I'll get to do just emergencies and not urgencies. And so, but it was just pulling teeth to get people to understand the concept and the fact that you can see someone.
Right.
And so, just a quick aside, I tell people, so when I used to sit at my desk in the emergency room, it's so busy. I mean, imagine not being able to go use the bathroom for 12 hours, not being able to eat. I mean, it's so busy. And people don't understand that's really what happens. It's that bad. Yeah. So I would sit at my desk and let's say, somebody ordered something and we're just taking a quick bite to eat. I would have to be able to see a person either walking by, being rolled by in a wheelchair or being rolled by in a gurney and be able to tell from across the room whether or not I needed to stop my meal. I had to have that. I had to have that astuteness because and I remember I could do it. And so I tell people that doctors are trained. They're trained to examine you with their eyes. We don't necessarily have to touch you all the time. From what you say to what we see, 90% of the time we can tell you exactly what's wrong with you. So, so when I'm talking about telemedicine, I'm talking about seeing a doctor over the phone, I tell people that 90% of the time we can diagnose you from across the room, at least by what the nurse said you're complaining of, what your vitals are, and what you look like. And so COVID hit, and we didn't have a choice. We were all in the house. People needed to have their medicine refilled. People needed to see their doctor. All of a sudden, we're all online seeing the doctor. And so
you was what y'all waiting for? Like, I've been
doing this. One of our local news companies called and was like, let's get you on here to talk about telemedicine. Oh, now you want to talk about telemedicine.
Okay, I'm ready. I've been ready for like 5 years, but I'm ready.
So yeah, it's been a blessing. It really has. I mean, with the universities and they're not able to go back to campus, or their campus is open, but they're overrun with students going to the student health clinic. Then we also offer our services to schools. And so
I saw that.
Yeah, one of our first contracts was Tennessee State University. So we're providing it for their students. Even the ones that didn't come back to campus can actually see a doctor from homes.
Because you could be a member, right? Like you can join and you can get unlimited visitors. I think you said in a household for up to 7 people.
Yes. You did your research.
That's what I do. But that's amazing to me because it's so important. Look, we all know that things are going to change. And I was totally against, this is way before COVID, way before everything. And they was trying to say how AI is going to take your job.
Right.
Do you remember when it was that way back?
Oh, yeah.
It was like everything was going crazy. AI is going to take your job. And I'm like, no, AI is not going to take my job. And they was like, you're not going to have a doctor, you're not going to need a doctor. It's going to be a computer and this, that. And I always say, there's no way I want a computer to diagnose me. Because then you're going back to WebMD, like you said before. They're not going to know nothing. And what's the example I use for that is when I had to have emergency surgery. I want to say about 3-4 years ago. Like I literally almost died because I had a blockage in my intestines.
Okay.
And I did not know, because I'm hard-headed. That's why my kids get on me today. Like, you wait to the last minute.
That's what Black women do.
Yeah, we wait till like, okay, like I couldn't even stand up. I'm walking like, and my doctor, just like you said, with your eyes, right? Because I refuse a wheelchair, even though I couldn't walk. Okay.
Right. That's how we do. I did the same thing.
I'm good. They're like, ma'am, it's going to take us 3 hours for you to get but I'm walking through, and I think she was like looking at something, and she looked up and saw me, and she said, what's going on with my stomach? And she just told the person, take her to x-ray now. Like, I haven't even was able to say anything. She just looked up at me and was like, what's going on? Because and she was like, just get some x-rays. Went from the x-rays. Before they even had me they made me get in a wheelchair then, because the guy was like, listen, we're going to take too long.
Right. Take you 4 hours to get to the x-ray machine.
So I get in a wheelchair and they roll me. And before they can put me on the bed, she was like, no, she has to be admitted to the hospital. So then I had to go but imagine if a computer ain't going to be able they can't see you.
Right. And I was never worried about AI, especially being an ER doctor. And everyone is completely different. So common things being common, I'll give it to them. So simple stuff, common things being common. Okay, great. But everyone's different. Everyone presents differently, which is why I love my job so much, is because there's never a dull day at all. So yeah, I'm not falling for the hype. I'm not falling for the hype. Now,
this is the best thing.
Yeah. Do I think that AI has a position or, a place in medicine? I do.
Yeah, but not when you're going to see me no. AI be done sitting here. I'm going to leave that alone.
Me too. At least for now.
Yeah, we need to be something much, much better. But you doing this, telemed is absolutely amazing. I mean, you can have not only the urgencies, but like flu and sinuses and respiratory infections. And I was even crazy about, now listen, I got to lean in because this is crazy to me. You can even do STDs.
Yeah, you can. Some of them require another test, but some of them are symptomatic. If we listen to your
okay, because in my mind, I'm seeing what I don't want to see. Like how you.
Right. So some of them are just from the symptoms.
Okay,
and
gotcha.
there's certain STDs that are just treated with a simple round of antibiotics. And so it's safer to give the antibiotics than to not, based on the symptoms. But yes, we're going to be partnering with some labs here, over the next few months or so, to kind of help coordinate all of that together. And so they'll be doing the STDs test.
Because my mom, I was like, oh. And of course, I see people with their pants unzipped, like, look,
right.
Like,
right. Well, no, that's definitely a possibility. If somebody has a rash or some bumps, they can take their camera and take pictures and send it in. We remember, it's your eyes. It's your eyes.
I'm like, never mind.
As long as they don't send it to the wrong person.
Which I have done many times. Old people on the goddamn thing, like, my bad.
Right. But yeah, so you can take a picture of it and send it in. The doctor, I mean, we literally have where you can upload your X-rays, upload your labs, and get second opinions on them. Upload pictures. I mean, to me, it's a no-brainer, and I mean, especially for the cost. Yeah, especially for the cost. I mean,
yes, get to that. Get to the cost of it.
Yeah, people. I always tell people. I'll give them my spiel. We have this. We have this. We have this. And then I'll say, how much do you think that will cost a month? And they're like, I don't know. I mean, at least about $150 a month. And I'm like, really? I say, come down just a little bit. And so they'll be like, about 75. And so I tell them, I'm like, it's $24.95 a month. And I said, that includes everybody. But so think of it this way. Think of it like AAA.
Yes.
When you need AAA, you need the works. You need them to come out there, jump your battery, change your tire, give you some gas. And you don't pay what it would cost for that person to come out there individually.
That
right?
Makes sense. You're right.
So all of us are paying for AAA. All of us are paying for AAA. We're only paying $59 a month. But when we need it, we may spend $400 a month. But all of the other people are spending the $59 a month. So it's kind of like collectively when we need it, So I tell people to think about it like AAA. And so the price for me, being able to negotiate these prices, I really want to help. And this is so like trite. I mean, every medical student, every doctor says they want to help people. I really want to help people. Number one, decompress the ER. And that's me being selfish for my colleagues. Right. But number two, have access to something that they deserve. Like they deserve to be able to see a doctor, at home and not pay $1 million for it. Like people deserve that. They deserve to be able to have a service that if they don't have insurance that they can still use.
And that was, I was going to ask you that. Yeah, they deserve it. Now, do you have to have insurance? Do you, so you could be uninsured?
Yep.
And it's still $24.95. Look, I sound like an infomercial. And it's $24.95.
And then it's like, but wait.
But wait, there's more.
There's more.
It's 24 hours a day, 7 days a week, and you can get a call back. Sometimes less than 23 minutes, you said.
Yep, that's true. One of our customers, she was in Michigan. So I'm in Tennessee.
Okay, yes.
She was in Michigan on a work trip. And now think about it. You're on a work trip, you're in a hotel, you don't know where anything is. And she messed around and got the stomach flu. And so she's just vomiting, puking, diarrhea. And so she called. I think she said she got a call back in 14 minutes. She was able to look up the closest pharmacy to her. The doctor sent the prescription to the pharmacy. Now she's in the hotel room, sent the prescription to the pharmacy, told her what all to buy at the pharmacy as far as, Gatorade and this, got the prescription. The pharmacy happened to be right around the corner from the hotel. Got back in bed. She said she had everything done within the span of like an hour and a half.
Wow.
I mean, that is amazing to me.
That is amazing because listen, we go on trips. We were in Mexico, Puerto Vallarta, in February of last year.
Okay.
And a friend of ours was not feeling well, right? So she was sick. It was a couple's crew. And she kept, she don't feel well. She has arthritis. She's all, so she was just not doing well. So every day she would do like, well, maybe I'm not going to come today. But at the resort we stayed at, it was a doctor that you can, have them come in. But do you know how expensive that was to have a private doctor come to? I was like, listen, my husband would let me dead. She died. She didn't make it.
She gone, y'all. She gone.
Yeah. But the weather is nice here. The weather is nice. Yeah, because then the way you said that about your client, she was able to still do everything she needed without, because I would be more afraid of the cost of things.
Right.
And it's not like I can't afford it. I don't know why I do that, but I come from poor. I feel you. I'm very, very cost everything, And of course, there's no price on your health.
Right.
However, like you said earlier, we as sisters are waited out. Like I'm be all right.
Right. We will, unfortunately. But yeah, it's definitely, it's something that I'm so proud of.
You should be.
And the different services that we're able to offer, everyone, people go to the ER, and I tell the story that I've had people come in, work at Waffle House. I worked night shift for 13 years. So I chose to work night shift. That crazy or not, I did.
I'm like, okay.
And so people would come in, let's just say, someone worked at Waffle House. They would come in 2 a.m. with pink eye. Well, when you stop and think about it, they don't need to be cooking somebody's food.
You're right.
And none of them they wouldn't have a doctor. They wouldn't have insurance. So they come to the ER. Well, just for pink eye, they would probably get a bill for about $800 coming to the hospital. But they didn't have a choice. Like, they didn't have anywhere else to go. They can't go to urgent care because they're going to ask for them to pay up front because they don't have insurance. And so I get it. Like, I get it. I completely get it. And so this way, and they can get their work note. I mean, our doctors will write work notes too.
Oh my gosh. It's amazing. It's really, I love everything about this.
Thank you. Thank you very much.
Everything about this. And I love how you said, well, one of the reasons you started this is because you said you worked in the ER, correct? And you saw how it was. So what made you say, we can do this a better way?
Well, I learned about telemedicine. The technology has been there since the 1990s. Yes, doctors have been using telemedicine for years. I mean, we've been using talking to different consultants over the phone and getting advice over the phone. In one of my presentations, I have this magazine article from 1924, and it shows a picture of what looks like a television, and it shows a kid opening his mouth, and then on the TV you can see a little doctor over there looking at the kid's mouth. In 1924. So, it's been envisioned for a long time. And so literally one of my friends, and I don't know how I had heard about it, but I never thought about it for patients.
Right.
One of my friends was like, hey, let's do this telemedicine thing. And so I thought that he wanted me to be one of the telemedicine doctors on the phone. Mm-hmm. And I was like, I got a job, boy. I got a job. I don't need another job. But then he was like, no, sell, get telemedicine to the masses. And so then I tell my wife all the time, it clicked. I mean, it clicked in my brain. And I was like, this is the future of medicine. This
is the future
is
of medicine.
the future of medicine. And unfortunately, it took a pandemic to kind of push us over the edge.
God works in
mysterious ways.
There you go.
Sure. So I really do think that people are going to get more used to it. And another thing that's helping too is that we'll FaceTime in a minute. We'll go Facebook Live in a minute. So looking at yourself or looking at somebody else on the phone isn't this taboo thing anymore.
Right.
You can pick up your phone and see your mom or see your kids, and you're used to talking to people that way. And if you think about it, there's a lot of stuff that you see and notice in the background that you can make a diagnosis of.
Girl, I'm just saying, when it first came out, and I'm so Wendy Williams, yeah, I'm gonna say it. Wendy Williams was on when she start working from home. I didn't notice it as much, but my oldest daughter, was like, "Dang, she got everything in her house. Like, where's she living? What is she doing?" And it's crazy because you do notice so much more than the person.
Right.
Like, I'm looking at you, but I can see your stuff in the back, and I can see all your awards, how accomplished you are.
Oh, yeah.
yeah. But you don't think about that. So, wow. I mean, you're such a visionary to come up with this concept. This is absolutely the future. And, my platform is all about being fit, right? And when I say fit, focus, intentional, and transforming. Okay. And doctor, that's all you are. You got an idea, your wife and you talked about it, it clicked for you. Mm-hmm. Then you moved with intentions. And what did that look like when you said, all right, I'm going to do this? What was the intention, that movement that you made?
Right. So it was really hard. Emergency medicine is my first love. Well, my second love behind my wife. I can't get in trouble.
Yeah, so, no, she might listen. She will listen.
She will listen for sure. She wants to hear this. So it was really hard to step away from something that I worked so hard for. I mean, most of these things back behind me are degrees,
Right, yes.
And so it was so hard to walk away. But what I kept telling myself is that you're not doing this for you. You're definitely not doing this for you. And what you're building is going to help so many people who need it. So many people who need it. So that was my motivation. All those sleepless nights, all those staying up all night long. I mean, being an entrepreneur is harder than medical school and residency ever was. I mean, like, take me back to medical school.
Liz, I can study. I'm smart. I can do this.
I can do that. I can do the residency. Good gracious. This entrepreneur game is like, oh my God, it's a trip. But we started a nonprofit that goes along. It's MyUrgencyMD foundation. And so what we do is we get grants and we raise money to be able to supply these memberships to people, or at least supplement some of their payments for people who can't afford it. Also, my wife is a judge, so she started a community court here in that.
That's awesome. That's awesome. Yes.
Thank you. She started a community court here in Nashville, the first in Tennessee, and for ages 18 to 30. And so her participants in the court, they've been diverted from jail. They go through her program. We offer them telemedicine for as long as they're in the program, because a lot of them are uninsured. A lot of them have children that, that they could use this for. So our foundation is what helps us get the memberships for people who wouldn't otherwise be able to afford it. So it's kind of twofold.
Well, what is your foundation?
It's the MyUrgencyMD Foundation.
It's okay. Yeah, I love it, because when I think of it, first of all, you guys are like the Huxtables.
That's what everybody says. But she's more like Bill and I'm more like Claire. She's the one that's like when COVID first happened, she's the one dancing around the house and singing. And I'm sitting looking at her like she bought us bikes and I'm breaking my neck on the bike. So she, that's what everyone says, that we're the Huxtables.
I love it. She was like, "This is gonna be great," and you're like, "I don't know about this.
I don't know about that.
I don't know."
Third day, I'm on the ground.
Well, at least you can call somebody 24 hours a day.
365. I got me a doctor on the phone.
That is the most amazing thing to me, because so many, especially in Black communities, we are a lot of times neglected in the system. Because even if you go to ER, like, and I'm quick to be like, wait a minute, we've been here first. I know you didn't make an appointment for ER.
Right. No, but sometimes we have to take people based on their complaints.
I know. I've been listening to everything though, because I'm nosy. Like my husband's like, "You nosy." I said, no. I'm a journalist. I just pay attention to things.
Right.
You know
I'm
what I'm saying? I'm observant. That's exactly what I say. He said nosy. So
it's both.
So yeah, it's well, whatever, it is what it is. And it's hilarious because I have seen where people prioritize. For me, one time I went in, I used to box and I dislocated my shoulder. I've dislocated 1,000,000 times.
Okay. Wow.
So,
see, look at you saying, "Oh, it was nothing. I just."
It was nothing. Yeah, I usually can pop it back in. But I couldn't pop it back in, so I drove myself to the ER, and I told them what's the thing, and I said, "I really think it's my dislocated my shoulder, blah blah. If it's dislocated, you wouldn't just be standing there."
Oh, that sounds just like a triage nurse.
Oh my God. I'm like, "Well, what do you, and I said, well, she asked me, who's with you? I said, I drove myself. Oh, you wouldn't be driving if you,
right.
No.
Right.
Like, just because you
don't see this divot. That's
can you not see like it's hanging down?
Right. I can't make that.
Why they did that. Stuff like that makes me so angry. And maybe people come and lie.
Oh, not maybe. No. Oh boy. So me and you probably could have a whole nother show about Tales from the ER, because and I'm trying to be here on MyUrgencyMD, but maybe do they lie? Every other person is lying.
So that's what it is.
And we get very jaded. We get very jaded and cynical because, and I hate to say that, but I mean, I remember the farther along I got into medicine, I had to check myself. Right. I was like, I have to remember these are some people's worst day of their life. Right. Mm-hmm. And I have to show that compassion still. Mm-hmm. And so I had to check myself. I mean, I had to do it often too. So some people just don't check themselves.
Well, she did come back and say afterwards, because when they did but what was crazy is I sat there for a long time, like a very long time, and they would let other people come in because that was an emergency. Right. Like, my arm is an emergency just because I have a very high tolerance for pain. Mm-hmm. So if I say I hurt, most people will probably already be passed out. Like, if I say, "Ooh, like this really this hurt a little bit," mm-hmm. Then I really mean it hurts. Mm-hmm. But she finally, when I did the thing, she was like, "Oh my gosh, I am so sorry," because most people, and I was like, "Thank you," because that made me feel better. Because I was thinking, wow, you shouldn't work at the front if you like next.
Right. Well, I'm telling you, that's the nature of the beast, and it's like they pick the ones. but you have to be resilient. You have to be resilient to be out there, because people will curse you out. People come in, they're trying to get back to their family. So you have to be very resilient. You can't be like some little meek and mild person sitting
like there. Me. No, Lord. Girl, I'll be working up front. Next.
Right. But like I said, I'm gonna have to come back for Tales from the ER. So we
definitely have to do that.
So I can definitely some of this.
Because what's so crazy is MyUrgencyMD.com. You can sign up. And like you said, to walk through an appointment, like you have the behavior side of it. And I want to talk about that as well before we wrap it up. Because I know you're busy, girl. But listen, the behavior side of it, how does that look?
So we have telephonic behavioral health. That to me, out of both of them, during these times, this is the most important. Mm-hmm. It has been shown that especially people of color, that our mental health is deteriorating at rapid rates. Our substance use is going up. 18% of Hispanics and 11% of Blacks during the pandemic said that they contemplated suicide within the previous 30 days.
Wow.
This pandemic is wreaking havoc on our communities, all of them, but people of color are even worse. And so this service, which is included, nothing extra, literally included in the price, 7 people can use it, is that you can talk to a master's level therapist, unlimited, to talk you through some of this stuff that's going on. I mean, you schedule an appointment. Now, I'm going to talk about my wife now. She's going to be like, tell them all my business.
Come through. That's what we do. It's just us.
It's just us. So, I have a therapist because everybody's supposed to have a therapist. She has a therapist, but by her being a judge, she has a staff of people. So she utilizes her therapist just for her staff issues. And that's the good thing about therapists. You can go to them with specific problems and talk through those problems. Most people don't think about
I didn't know that. I need a husband therapist, like one I could just go talk.
Yes, like a situational. You go and you talk about a certain situation. Like it may be grief. Someone may have just died and you may want to talk that out. Well, she was able to schedule a weekly appointment with the same, and you get the same person. It's not just you pick up the phone and you're talking to random people. You get the same person every time you call. If they think that there's something a little bit more, that they can refer you to local resources. If they think it's an emergency, they will send the police to your house. So yeah, this to me, I mean, I know how expensive it is to have a therapist. Like I know. And not to mention the names of some of the other ones that you're hearing on TV and things. Those cost about $280 a month.
Right.
And they're text messages and one phone call and maybe one face-to-face or something like that. So this is included, $24.95. You get to see a therapist. You get to talk to a therapist. They'll do family sessions. Like I said, it's amazing. Even I am amazed.
I'm signing. She said, even I'm amazed at myself. Like, even I.
Even I am like, wow, you are a part of this? What in the world? What did Snoop Dogg say? I want to say thank you.
I want to say thank you to me.
I'm not
all
really
the
like
hard
that.
work that I did.
I'm not really like that for real.
Oh my God, that is so funny. Like I got tears because I could just say, oh my gosh, this is so amazing. Because I'm signing up today because just that alone, and especially now. And I was talking to my brother the other day, and I was saying how my whole life, well, basically he was saying, my whole life I have been preparing for COVID. Because I'm really not a real big, like people think that I'm like the most outgoing. I am when I'm out.
You're out. Okay.
But I'm really an introvert. Like I really want to just be at home. Like I've been working from home. Like you said, I've been doing this Zoom stuff before COVID even came around. I've been doing all this stuff and I'm just a homebody. Like I just like being by myself.
Right.
So when COVID came around, it was amazing because now I have to lie and say, no, I can't come. I'm busy. And I'm like painting my nails.
Built-in excuse.
Built-in excuse. But saying that to say, I finally got to a point, I think it was like last weekend. I'm like, yo, I'm bugging a little bit. Like, I kind of need to get out. And I moved here from California.
Okay.
And I'm in Charlotte. So California, we don't, I mean, our winter is like 60 degrees.
Right.
You know, and then we got our Uggs on and our hats, and you know, we freezing at 60.
I'm from Michigan originally, so I don't even understand that.
Oh my gosh. Yeah. So you good. Like you would do fine here because people say,
I don't like snow.
I can't do it. I just can't. My body can't. It physically hurts me.
I bet.
So it's too bad to go out. The weather's too bad to go out somewhere and do, like we would go out, sit outside and eat or take a walk. Well, now it's too cold. So that has been really, really messing with me. And again, if I say something, it's serious. So I told my husband, like, yo, man, I'm starting to feel a little, but it's nothing to do. And he goes, of course you're going to have a meltdown when we're at the height of everything and now they're cutting everything down. And I was like, I don't know what to do. So that would be great to have somebody to call.
Yes.
And because it has been very difficult. And I'm saying that to say if it's difficult for me, a person who always want to stay home.
Yes. Yes.
It has to be really hard for people who are go, go, go.
Right. If you were to look up, I mean, just take a strategic Google search and look up just mental health and COVID.
Mm-hmm.
I mean, the things that pop up, I mean, it scares you. It really does. It scares you.
Suicide is high.
Suicide is going up, and it's going up in teens, and especially Black teens. It's still low for Black teens, but it's steadily going up.
Mm-hmm.
I mean, we have a lot going on. People still have untreated diseases and you know, food deserts and all this kind of stuff. So the stressors that we normally have, we're just piling on this pandemic. So now we're worried about unemployment. We're worried about where we're going to get our next meals. We're worried about if our family members are going to pass away. Right. I mean, we're worried about everything in addition to the stuff that we already have to worry about.
Wow.
So I think the behavioral health part at this moment in time is probably one of the most important, one of the most important services that we have. I really do.
I'm all in. I'm going to get my membership today, guys.
Thank you, girl. Thank you, girl.
Mm-hmm. Yes, because I think it's so important, and I'm going to do it for my daughter. And she's in Colorado Springs. She has medical insurance through the military, but she has to go on base. She has to get this and all that. And I'm like, listen, now 24, 95. I keep saying it. Every time I say it, I think of my infomercial. 24.95.
Right.
And it's up to 7 people in a household, and you can call anytime. I really wish I had this before my kids want to tell me I'm dying from COVID, like last week.
Well, how about this to make it even sweeter?
Okay.
I'm going to do a promo code for your listeners for $5 off a month. And
get out of here, Doc.
I promise.
Oh my gosh. That is amazing.
It'll be Misfit One.
God bless you.
Yes.
You know, because this is exactly what we need at this moment.
It is.
And just the fact that you had you foreseen all of this before it even came up. The vision.
I saw it. I did. I saw it. I mean, it was I mean, and I'm sure you've probably had this experience before where based on what you do, where you see it and no one else does. And you feel like you've completely lost your mind because
I'm crazy. Yeah.
Yes, because you want to put everything into it and people are just like, what, girl? Telemedicine. Okay. Ain't nobody really gonna be seeing nobody on the phone. But if you want to do that, go ahead, girl.
Okay.
Put money into it, fine. If you want to quit work, I don't know why you would want to do that.
But go ahead.
Go ahead. You'll be fine, I guess. So, we'll see you back in the ER in a couple of years.
Right. You're a smart girl. You'll figure it out,
So yeah, when you're a visionary, and like I said, I could just tell that about you. You you see it and you know that it's going to be successful, even if it takes 10, 15, 20 years.
Correct.
But God drops it in you and it won't go away. And
Right.
even when you start to see it manifesting, it still doesn't go away, because then he gives you a bigger vision.
It's growing. Yeah, now it has
growing.
expanded. Yeah. It's like, wait a minute. I thought I was going to do just this, and now I got to do all this. Yeah. Right. And that's amazing.
Right. So like I said, I can tell that you're also a visionary, and I just appreciate you letting me talk about it. As you can see, I'm very passionate, very, very passionate about it.
And you should be. This is literally something that should be in every household. I mean, we have amazing insurance, great insurance, but I can't get to my doctor as fast as I can talk to you. And even with our insurance, what's $24.95? I mean, seriously, we'll spend that on lunch.
Right. I had a mover come to my house. We had to move some boxes from one place to another. And he didn't have insurance. Because I asked him, I was like, "Do you have insurance?" I'm always trying to, I'm a businesswoman. And so I stood out there and talked to him for probably about 15 minutes. Uh-huh. And before, about an hour later, his order came through. I mean, literally, it was amazing to me. That he I was able, it's always amazing to me that I'm able to talk to someone and they are able to, they go and purchase a product from me.
Because they get it.
They understand it. Yeah. They understand it. And so I think that he got it. I mean, and we had a great conversation about it. And I said, wow, COVID really helped me, because
thank you, God.
He actually knew what telemedicine was before I started talking. I'm amazed. I'm blessed. I'm so excited about the future and the possibilities. We didn't even get a chance to talk about the patient advocacy part.
I was just about to say, listen, we have so much. You're just so fascinating to me.
I appreciate it.
And all that you do. Just, if you have time, can you just give us everything, that we have so much to talk about? What we were unable to talk about. And then we will have another discussion to kind of keep it going, because this is an ongoing subject, so please fill us in on the other things that you have.
So what we also have, in addition to the telehealth, the behavioral health, and then the Message a Doctor. So we have Message a Doctor, which is email, where you can talk to 9 different specialists. That's where you can get the second opinions. We have alternative medicine providers. We have sports medicine providers. We have pediatricians. This is where you can ask any question that you want to a real person, not Google. Finally, what we have is patient healthcare advocacy. And what that is are advocates who can help you with everything healthcare. So let's say, for instance, you were one of those people that had to go to the ER in the middle of the night and got an $800 bill. They can help you negotiate those down, negotiate terms and conditions. Set up payment plans for you. They can also make appointments. Let's say you have insurance and you're not sure who's in network, who's out of network. They can help you make appointments with people who are in network, tell you what your deductible is going to be, how much you're going to be out of pocket. If you're uninsured, they can help you find insurance. They can help you find charity care, Medicaid. I mean, anything you can imagine when it comes to healthcare. Just mediating between the doctor's offices and you explaining your insurance plan to you. So if you have insurance, you could just say, look, I don't understand this. How much is it going to cost when I go to the doctor? How much are my prescriptions? Can you tell? They will audit your medical records. Wow. To see if you were double billed for things. Like if you were in the hospital, they will audit your records to see if you were double billed, charged too much, or anything like that. So that's also included, also for everyone in your family, and it's with in the case of your listeners, $19.95 a month.
That is crazy! Like I'm just I'm about to jump up and down because it's phenomenal. Everything that you do. You represent Black excellence to me. And that means so much to all of us, for you to step out and help the community, help everyone, because health is definitely our wealth. I believe that. And mental health, physical health is so important in order for us to survive. Right.
Sure. Mm-hmm.
So thank you again. Now let's give them where they can come and sign up, because everybody gonna sign up and use the code MisFit1 so that they can get it for 19. Girl, that's crazy. 19.
Yes. So if you'll visit MyUrgencyMD.com, so that's MyUrgency, M is in Mary, D is in dog, .com. We will be happy to have you, and we will treat you like royalty.
I love it. Thank you so much, you guys, for listening and learning all of this today, because a lot of times it's a subject that we really don't want to talk about. Doctor, I don't care. But just by you tuning in, it tells me that you care about your health. And you care about not only your health, your family's health. And so Dr. Dorsha is here for you 24/7. And I am here for you. Please, you guys, go out, support her, sign up on the website. If you have any questions, you can always reach out to me. I'll have her information on my website as well. So, till next week, you guys, stay fit.